The reason we like to fix the septum at the same time as a rhinoplasty is that you always should have 1 centimeter in the front of your nose and on the top of your nose of your septum left over. So if you're having a rhinoplasty, you want to take down the hump or do what you need to do to the nose and then measure 1 centimeter and make sure you preserve that 1 centimeter of your septum. Even if that part is crooked, you kind of have to keep that in place, because if you don't keep that in place, your nose collapses. Hey guys, it's Dr. Samir Undavia from NJ ENT and Facial Plastic Surgery. And a question that we get asked a lot is, can I have my sinuses fixed at the same time that I have my rhinoplasty? And the shorter answer is absolutely yes. Let me explain it a little bit more. So you definitely should have your sinus surgery and septoplasty done at the same time as your rhinoplasty. I'm going to go over the septoplasty part first. The reason we like to fix the septum at the same time as a rhinoplasty is that you always should have 1 centimeter in the front of your nose and on the top of your nose of your septum left over. So if you're having a rhinoplasty, you want to take down the hump or do what you need to do to the nose and then measure 1 centimeter and make sure you preserve that 1 centimeter of your septum. Even if that part is crooked, you kind of have to keep that in place, because if you don't keep that in place, your nose collapses. So you want to make sure you do that at the same time. Let's say you had a rhinoplasty. Let's say you had a septoplasty first, and then later on you wanted to go get a rhinoplasty. You might not have enough cartilage, and you're looking at second and third best alternatives to help fix that problem that's been created by not having enough cartilage. And there are fixes for that. It's just, if you have the option to do it at the same time, do it for sure. The second most important reason is that the cartilage from your septum can be very helpful in reconstructing the outside part of your nose. I do that all the time. Grafting can help create a crooked nose to be straight. It can make a nose more projected. It can just smooth out contours. There's so many reasons to use the cartilage from the septum for the outside part of the nose. And then the third important reason is that it can also be financially helpful. It can help cover some of the costs of the rhinoplasty. So it's definitely helpful to do the septum at the same time as the rhinoplasty. Sinus surgery is the same way. People think they're the same. They're slightly different. The sinuses are next to the septum, and they help to lighten your head and to resonate your voice. And sometimes they can get clogged and give you headaches and recurrent infections and facial pressure. And you really want your nose to be teed up at the end of your rhinoplasty. You don't want to be harboring any infections inside your sinuses. You want to make sure that when your patient is healed, they don't have any trouble breathing. They don't have any issues with their nose. They just want to kind of forget about their nose. They want to move on from that. So you want to try and combine the recoveries. You want to make sure that your nose is teed up so that the sinuses can't really infect the rest of the nose. The only reason there's a little bit of a lengthier explanation for this is that, when it comes to the septum, we can do everything through the rhinoplasty. When it comes to the sinuses, we need special equipment for it, which means there's a special workup beforehand. And you also need to be trained in that. So you want to make sure your surgeon is trained to take care of the sinuses, or they have an affiliation with somebody that can help them with the sinuses at the same time. So part of the workup for fixing your sinuses is getting a CAT scan, trying sinus rinses, trying all the routine conservative measures first. And then once you get the CAT scan, then you need equipment. You need equipment to fix the sinuses. And so that involves navigation equipment, the sinus equipment to make sure you do open the sinuses nice and safely. So that involves insurance for most patients because they are totally two different sets of equipment. So we like to engage insurance beforehand, especially to get the CAT scan and to authorize that part of the insurance. And insurance doesn't cover the cosmetic portions of the procedure, but they need to be involved for the sinus part of it. So that's something that you should discuss with your surgeon beforehand, just to make sure you're both on the same page.